Hey everybody, Jason here from Learning Team 2, looking to kick off our tech talk today regarding blockchain and healthcare. So blockchain. With the advent of commission-free trading platforms and cryptocurrency popularity over the last few years, my mind quickly goes to fintech or Bitcoin when I hear the term blockchain. However, we're not making any financial investments or looking to enter the market. So let's talk about blockchain and then let the rest of the team tell you about some digital native companies coming onto the healthcare landscape implementing blockchain technology. So blockchain is basically a digital ledger. You have an initial data set that you enter, and we'll call this the first block. This block is tagged with a unique code, and any subsequent data entry representing change to the first block is also provided with a code which is linked to the previous block's unique code, hence a chain. In addition to this, the ledger is a decentralized peer-to-peer network, and it's spread with open source coding. So, why does all this matter? Well, it ends up being that the data is then immutable, meaning that you can't alter the prior block and there's no administrator to manage the data or change it. Also, it's transparent since it's decentralized and over a peer-to-peer network. In addition to this, the peer-to-peer network provides fast availability to the data. If one or more of the peers in the network fail, there's still multiple other ways to get to the data. And finally, it's very secure, as there's cryptographic algorithms providing the integrity, and consensus is required from all the network members to verify the data. So all this to say that blockchain provides a secure way to record transactions and track assets, tangible or intangible, in a business network. So now let's let the rest of the team kick off and talk about two companies leveraging this technology.
Thank you, Jason, for your excellent introduction regarding the fundamentals of blockchain technology. I'm going to introduce a company that is utilizing blockchain technology to put patients in charge of their care. PocketDoc is leading the charge with DocChain, their technology for healthcare on blockchain. DocChain is a distributed network of transaction processes operating on both financial and clinical data across the healthcare industry. The goal is to leverage blockchain technology across a broad range of industry participants to pave the way for a new healthcare economy in which data and services are quantifiable and exchangeable. The security and privacy of sensitive information will be reinforced by strong guarantees, and transaction activity can be audited longitudinally. Benefits of DocChain. It is secure. It encrypts, distributes, and controls data so there is no single point of failure. It is automated. Replaces many manual, paper-intensive functions with automated processes. It is auditable. It keeps permanent record of key elements of healthcare transactions without storing personally identifiable information. It is controlled. It solves the current disconnect between patients' desired access and control over their healthcare information, and the healthcare system's ability to provide such connectivity. PocketDoc's platform as a service enables healthcare organizations to quickly build modern commerce experiences across the healthcare value chain. Users can plug directly into over 700 trading partners to access real-time transactional data at scale. The developers of PocketDoc gathered the best healthcare data available and invested in cleaning it, integrating it, and putting it behind a simple API. The PocketDoc Health Platform includes access to a specialized dashboard that allows users to monitor API usage. The dashboard tracks the usage of each API endpoint so users can see at a glance rates of success and response times for monthly requests. PocketDoc also allows users to manage asynchronous requests from their dashboards and get immediate feedback on their status.
Thank you, Jason and Sarah. Next up is a company called Patientory. Patientory is a blockchain-based platform that seeks to decentralize patient health data and give ownership of that data directly back to patients. As a HIPAA-compliant solution, Patientory seeks to disrupt the standard ownership of health data without compromising patient security. This company offers two interrelated solutions. First, they offer a consumer-facing application that aggregates a patient's complete health data from sources such as their electronic medical record, patient-entered data such as how much water a patient drinks in a given day, and wearables like an Apple Watch, which tracks sleep patterns and physical activity. Additionally, Patientory offers an enterprise solution that they call Neath. Neath targets healthcare organizations who can create reports and predictive analytics based on these decentralized patient data for a better look at overall population health. According to Patientory, Neath empowers medical professionals, healthcare organizations, and employers with actionable insights into healthcare data to improve population health outcomes while engaging patients in that process. All of the data from both of these solutions is stored in the same blockchain network, which they call the PTOI matrix. Finally, Patientory also offers a digital cryptocurrency called PTOY that drives this blockchain network and allows for an additional source of revenue for the Patientory enterprise. According to Patientory CEO Kristen McFarlane, Patientory's offerings are still in the early pilot and implementation phases, but they see a critical mass of users joining their platform in the next 5 years or so. Next up is Nirali, who will offer a comparison of the business models and revenue structures between Patientory and PocketDoc.
Thanks, Sarah and Hunter, for the recap of PocketDoc and Patientory. I'll now give a brief overview of each company's business models. Let's start with PocketDoc. PocketDoc was established in 2011 with headquarters in San Mateo, California, and a satellite office on the East Coast. It is a private company with approximately 100 employees, and they have generated approximately $55.3 million from various investors. With the business-to-business model, they offer platform as a service. Fee-for-services can vary from small startups to large enterprises, depending on the business's needs, allowing customizable solutions, which highlight PocketDoc's flexible platform. PocketDoc has plans with a broad consortium of companies, some being Intel, Amazon, Capital One, Guardian, and Ascension. And now let's take a look at Patientory. Patientory is still in the startup phase and noticeably smaller in comparison to PocketDoc. Founded in 2015 with headquarters in Atlanta, Georgia, it is also a private company with no more than 10 employees. As of today, Patientory has generated approximately $7.2 million. Like PocketDoc, it also has a business-to-business model, however offers software as a service. Planned partnerships with Startup Health and Kaiser Permanente will help validate and promote their product moving forward. I'm now going to hand it over to Ashley, who will dive into these companies and how they are becoming more innovative.
Thanks, Nirali. Let's look at PocketDoc first. As mentioned, PocketDoc offers a blockchain solution called DocChain. Through a partnership with Intel, DocChain uses a HIPAA-compliant chip technology that allows for transactions to occur instantly and securely. The platform, built on an open-source blockchain, offers several features including identity management, benefit verifications, and payment risk solutions. One company using DocChain technology is Change Healthcare Intelligent Healthcare Network. The integration of DocChain with the Change Healthcare Intelligent Healthcare Network added new capabilities for digital healthcare services, including telemedicine, that further supports patient-centered care. Next, let's talk about Patientory. Patientory's customer-facing app provides a patient's healthcare data directly to them. The Patientory platform then aggregates data from wearables and then provides a patient with a comprehensive picture of their overall health. The app then provides the patient with actionable insights from healthcare data, creating incentives for them to take active control in their healthcare journey. In early 2019, Patientory integrated IrisGuard technology within their app for biometric authentication, which provides an added level of security for the patient when accessing their biological data. Finally, Patientory's enterprise solution, Neath, provides healthcare organizations with tools to analyze population health data. Success has been seen in the pharmaceutical world, where they've been able to recruit patients for clinical trials based on this healthcare data. Such successes include Neath's participation in recruitment for the Moderna vaccine clinical trials. Neath has also partnered with insurance companies, health employers, and healthcare providers. To recap, blockchain technology is a decentralized data storage system that records transactions and other data securely. Information stored in a blockchain cannot be modified or hacked. If data stored in a blockchain is modified, This actually creates a separate block within the chain where you can see both the original data and the modified information. We then discussed two companies, PocketDoc and Patientory, who are using this blockchain technology to disrupt and innovate the healthcare industries.